My name is Sophie Olson, and I'm a survivor of child sexual abuse. For safety reasons, I can't show you my entire face, but I can tell you about my dream visit to the dentist. It starts with the website. I read that the dentist has received trauma-informed training from survivors of child sexual abuse. The information online suggests making contact to discuss an individual survivor care plan. This makes me feel heard and hopeful. My anxiety is high, and my advocate drives me to my appointment, and we enter the building together. The receptionist is so friendly, calling me love and asking if I'd like a glass of water or something to read. I'm too cut off to speak, but that doesn't seem to bother her. She's warm and welcoming. It makes me feel hopeful. The waiting room is light, full of plants, and with bright pictures on the wall. It's not like a waiting room at all. It's like somebody's front room. It makes me feel hopeful and encouraged. We sit and we wait in a separate area to the other patients, as pre-arranged on my survivor care plan. I feel heard. I don't have to hide my fear in shame and fear of being misunderstood or embarrassed. The dentist comes out of a room with a patient, and I know I'm next. I am frightened, but I've already met her over Zoom, and this helps reduce the anxiety. She smiles and greets me by name and reminds me that we can take this at my own pace. I feel listened to and understood. I feel like a person, not a thing. When we go into the room, she introduces me by name to the nurse, who smiles and asks me to say when I'm ready to sit in the chair. This makes me feel safer and in control. I need to know who else is around me when I feel vulnerable. In previous appointments, the nurse was never introduced like this. The dentist asks if it's okay for the chair to be reclined, and I agree, but I feel sick and quite detached from myself. My advocate and the dentist notice signs of dissociation. The chair is gently raised back up, and I'm asked what I need to feel more grounded. I ask for some water, and after a minute or so, we try again. The chair is only reclined slightly. This makes me feel safe, listened to, validated, hopeful, and in control. I hold a cushion that I brought with me against my chest. In the reclined position, it makes me feel less vulnerable, and it acts as a barrier. It protects my breasts. I don't play music on my headphones, as was discussed. I can see why it might be helpful for others, but I need to be aware of all the sounds around me. In our initial meeting, it was decided that my dentist would not check for physical abnormalities on the outside of my head and neck, and to only have the necessary procedures done this time. I feel heard and understood. I don't feel ashamed. My dentist is gentle. She informs me every step of the way and asks me for permission before touching me. She tells me what she's doing, what she's looking for, and what will happen next in a low, calm, and gentle voice. It feels reassuring. Someone starts to come into the room. Maybe it's the receptionist, I can't see. The dentist calmly tells them to wait outside. On my care plan, it states no one else can be in the room other than the necessary members of staff and my advocate. I feel heard and that my needs are respected. I do have a voice. The dentist's fingers are probing inside my mouth. I experience an immediate flashback to oral rape. I remember the taste of blood. I squeeze my advocate's hand, who asks the dentist to stop. The chair is raised, and I spend a few minutes practicing my grounding techniques. I have another sip of water. When I feel ready, we try again, and the examination continues. I'm okay, and suddenly it's over. The dentist is kind. She says we can talk through the checkup and discuss follow-up treatment now or at a later date. We agree that an email summary would be useful as I just want to go home. We are directed to a quiet private area. I have a drink of water and sit quietly for a few minutes before I feel ready to leave. The receptionist sorts out payment with my advocate because I can't manage that, and says a friendly goodbye as we leave. My advocate drives me home. I feel tired but relieved. I don't feel ashamed of myself or re-traumatized by my experience. In a few days, I feel able to make the follow-up appointment and think that next time I might even try without an advocate.